it's Ejeffery again, and now I'm going to be doing a second video, which I'm going to include the oral hygiene part as well as the stockings on Electra here. And I already confirmed her identity. We already did the bed bath. So now I'm just going to go in. She is, we already did our identification, and I already told you that we're going to be cleaning your teeth for you. She says that she doesn't feel comfortable though for us actually doing her teeth, but I'm going to pretend, and I'll verbalize everything for you for her being conscious and what I would do with an unconscious patient as well. So I would place a towel under her head, and also I would have the bed rails down, have it at a proper working height, and put that there. Okay, I'm going to have her move her head just like slowly like this, and I would place a spitting tray, like something to catch right here underneath her. Okay, and all right, if she was wearing, do you have dentures in? No. So if she had dentures, we would take those out, clean her mouth with like say a foam, like instead of a toothbrush, like a sponge, and we would wet that in the warm water and clean her mouth with that. Take the dentures to the sink, do the proper cleaning with that, and do that. But we don't have to do that with you. So we're going to wet the toothbrush. I would have gloves on as well after I practice hand hygiene, and we would start with wetting the toothbrush and wetting her mouth. And then after all I was done that, I would also have you spit in a cup. You need to. Okay. And then I would put a little bit of toothpaste on there, and I would start scrubbing up and down on her teeth. Okay. And we would go in another way. We would go like this when we're going on her chewing parts of her teeth. And then if you feel like you need to spit, you can go ahead. Okay, and we'll wet the brush again, and then we're going to continue making sure we get all the teeth going up in the upward motion here, up and down, and scrubbing. Now we're going to rinse that out, and she can spit again quite frequently. If she wasn't able to do that, we'd have, but also if she can hold her mouth up as an unconscious patient, we would put like a tube in her mouth right here to help stabilize it open, and a sucking machine as well. And now we just wet the brush, and we're going to make sure we get the roof of her mouth, and we're going to get her tongue, we're going to get her inner cheeks as well, and then spit. And I'm always paying attention to any like bleeding, sores around the mouth, anything like that as well. You're always observing. And then when we were done that, make sure she clean her all up, and we'll take the toothbrush away. And always make sure she's in a 45-degree angle as we're doing it. We're going to clean the gum line. We're cleaning all the surfaces. We start from the inner, and then we go to the outer. We have that suction catheter. That's what that suction device would be if we were using it for an unconscious patient as well. And I would, sometimes we'll put like, say, Vaseline or chapstick and put that around her lips as well. And we can move that little dish for you. And really, that's all it is. Just clean your mouth, clean your mouth. And now we're going to move on to the feet. So after I was done all that, I would clean up what I was using for the mouth and remove my gloves and practice good hand hygiene. Now we're going to pretend I'm still wearing these gloves. I want to use them for when we're doing the other one. Not these ones, would use clean gloves. So we're going to just put some stockings on. Okay, so when doing that, we're going to be checking her leg here, and we would measure the circumference here and here, or lengthwise here, depending on how high the stocking needs to go on, and we'll compare those measurements to the manufacturer for the stockings. Right here we have these socks we'll be putting on her, and I'm also checking here, I'm checking her pedial and the proximal pulses, and I'm checking for any lesions, anything like that. We want to make sure the socks are going to be flat on her. So you're going to turn the sock inside out, as so, like that, half inside out. So we want to make sure we keep it flat. I'm going to be putting them over your toes as so, and make sure that the heel is in the heel pocket. There we are. And we're going to pull this up and make sure I let you know, please don't pull these down or they can cause bruising, or just make sure you let them stay in the right position, okay?
Okay, ma'am.
All right. And I'm also checking the skin integrity as I'm doing this as well. You see, they're all, here we go, nice and comfy. Awesome. The little ice cream cones.
They're so cute.
And then,
Ice cream after.
there you go. Put your foot on, and we slowly slide it up here. Being as gentle as possible. And making sure that they're all nice and flat as well. Around there. Oh, in your heel pocket. And if that happens, just make sure you adjust it. You're nice and warm. Okay? Awesome. And by doing that too now, I'm making sure there's no wrinkles, folds, any discomfort. Do you feel any pressure or anything? And this will help you with your circulation and things. That's the reason why we're doing the socks today. Okay, here we are. And I'm going to thank her for letting me put your stockings on.
Thank you for putting them on.
And I'll make sure that she has her call bell, put the raise the bed, arm rails, walk out, and discard the gloves, hand hygiene, and that is all.